Now, welcome folks to the second part of the circulatory system, and this one is going to focus on the vascular system. So the vascular system is basically a whole bunch of tubes that start off by branching off of the right ventricle. We start with that bigger artery known as the aorta, and then it keeps on branching off to smaller arterioles, and then capillaries where the exchange of gas happens in on the tissue level, and then we have to bring all of that blood back to the right atrium through venules and veins. What this whole system is a closed system. There's no leaking happening, meaning that, if there was a leakage, that would mean that the person is bleeding internally. And there is also that smooth endothelial lining that was continuous with the endocardium of the heart, which is basically a very smooth layer of simple squamous epithelium. And that you'll find that it is continuous with the endocardium throughout all of the blood vessels lining the inside of all of our vascular system. And that is the line that is in direct contact with the blood flowing inside of the vascular system. So let's introduce the different vessels that we just talked about. And here this is from an exhibition known as the Body Revealed, or the Bodies Revealed. It is a great exhibition. If it ever comes into your town and you're able to visit, I highly recommend you do. It is made out of waxed cadavers, and part of the exhibition is this great show of the vascular system and how rich it is. You could see the bigger arteries like the aorta branching off, for example, to the two common iliacs. And then you could see a whole bunch of smaller arterioles. The capillary system is more of a microscopic structure, so you won't be able to see it. So what we're seeing here is the arterial system. So now moving on to compare the different features of our blood vessels. So we'll start off with the artery. These arteries are the biggest of the blood vessels on the arterial end. They have three layers. There is the external layer, or the tunica externa, that's made out of mainly elastic connective tissue, and it is there for protection. It also, all of that elastic tissue supplies or makes these tubes in compliance with the changes of blood pressure. So when the ventricles contract and push the blood into these large arteries, the elastic tissues allow for these blood vessels to expand, and then due to the elastic recoil of these vessels, the blood will be pushed further downstream. You can also see the middle layer, or the tunica media, and that's made out of smooth muscle fibers, and then the tunica interna, or that endothelial lining that we mentioned, that is made out of the simple squamous epithelium. These elastic tubes, as we mentioned, are compliance tubes, and they are considered pressure reservoirs, meaning that they are going to maintain that high pressure that was developed due to the contraction of the ventricles, again, due to that elastic tissue found within the tunica externa. These blood vessels are going to expand, and then the elastic recoil will push all of that blood vessel downstream, all of that blood downstream the circulatory, or the vascular system. So these large arteries are compliance blood vessels and pressure reservoirs. That brings us down to the arteriole, and you'll find here in the arterioles we kind of start losing or lost the tunica externa, so there's no elastic tissue in this point, and we're basically down to the smooth muscle fibers and the tunica interna, or the endothelial lining. These smooth muscles are extremely important because they regulate the blood flow to individual organs. So depending on the need of the organs, if there is an increased need for more blood, these smooth muscle fibers are going to relax. That would dilate the arterioles and bring more blood into the organ, while the opposite would happen in the opposite scenario. So if the organ doesn't need all of that blood, these smooth muscle fibers are going to constrict causing vasoconstriction, or the decrease in the diameter of that lumen that would decrease the amount of blood going to organs. So the arterioles, again, it's all about the smooth muscle fibers regulating the blood flow to individual organs. Then as we move from arterial to a capillary, we'll start losing the smooth muscle fibers, and at the capillary level, all we have are a single layer of simple squamous epithelium, or these endothelial cells. Endothelial cells have tons of functions, and we will get to that when we talk about capillaries. But one of the most important functions is that it allows for the diffusion of gases. Oxygen will leave the capillaries. If we're talking about the systemic circulation, oxygen will leave the capillaries to go to the tissues, and in exchange for carbon dioxide diffusing from the tissues into the capillaries. Now we need to gather all of that deoxygenated blood and bring it back to the right side of the heart. So we start off with these smaller venules, and you'll see here that again we have the endothelial lining, and we are going to start to develop some connective tissue. There really isn't a lot of smooth muscle fibers when it comes to venules or even veins, and venules are really capacitance vessels. These vessels are going to start becoming kind of like storage for blood, and in addition to that, these venules have high permeability. So the capillaries are very permeable. Venules have kind of like that same high permeability, especially if there's an inflammation or an infection that will lead to, the white blood cells and inflammatory fluid is able to leak not only out of the capillaries, but out of the venules. Now, for these large veins, you can see here the endothelial lining and mainly connective tissue, very, very minimal smooth muscle fibers. And the veins, large veins, are known as blood reservoirs. This is where the majority of our blood is actually going to be stored. And because of the lack of smooth muscles, remember that in order for the venous blood to return to the heart, a lot of this blood is going against gravity. So the blood going from the lower limbs and the blood in the upper limbs, that venous blood would have to go up against gravity in order to reach the heart. And we'll see how the veins are able to do so. Now we'll take a look at the pressure changes, systemic versus pulmonary circulation. In the systemic circulation, the blood pressure tends to be higher than in the pulmonary, and that's for several reasons. In the pulmonary circulation, you have the right ventricle, which had a thinner myocardium, pumping the blood to the very close by lungs. While in the systemic circulation, you have the left ventricle, which had a thicker myocardium, pumping the blood into the aorta to distribute that blood to the rest of the body. So you need higher pressure in order to do that. And you can see that our systolic pressure is at about 120, and the diastolic is at about 80. And as you go from the arteries downstream, arterioles, capillaries, venules, and then down to the veins, you see how that pressure gradually decreases until we reach in the veins. You can see that it almost reaches about zero. It's not zero, but it's about maybe 3 or 2 millimeters mercury, which is a very low pressure blood vessels, which again makes it harder for that blood to go back to the heart. So again, how do the veins overcome that, and how does the blood eventually go back to the right side of the heart? And we will answer that question when we get to the venous system. So we're talk first in this segment about the arteries. The arteries, as we mentioned, are basically elastic tubes that have that are able to dilate are able to distend due to the pump of blood into them. They have these very large radii, so there's a large radius to these arteries, and low resistance. So that elasticity, all of that elastic tissue, gives it compliance and low resistance. The resistance really would be coming from smooth muscles, not the elastic tissue. And that's why these arteries act as a pressure reservoir. in order to maintain a high pressure to be able to pump the blood from these bigger arteries downstream to the arterioles. And you can see what happens in these arteries. So right here, the blood is pumped from the heart into the arteries, and then from the arteries, it would have to go down to the arterioles. So let's take the left ventricle as an example. So as the left ventricle contracts, so that's systole, it'll pump the blood into the aorta through the aortic valve. And you can see here how that aorta distended due to the, because of the compliance of the aorta, again, due to all of that elastic tissue, allowing it to distend with the blood being pumped into it. Now, during diastole, when the left ventricle is relaxing, the aortic valves shut down, and the blood is going to be pumped pretty much due to the elastic recoil of the aorta pushing the blood downstream into the arterioles. And you see here that the blood really cannot go back into the left ventricle because of the closure of the aortic valves. So again, during systole, the arteries are going to distend due to compliance. And then during diastole, due to the elastic recoil, that's going to push the blood further downstream. And you can see here a typical change in the blood pressure of the arteries. So you can see during systolic pressure, the pressure goes up, and then during diastole, the pressure would go down. And that little dip happens during the closure of the aortic valve. So as the ventricles relax, there is like this millisecond where the before the aortic valve shuts down, where the pressure goes down significantly, and that is recorded when we record that changes of pressure in the aorta. But then, kind of goes back up, and then your main focus on the diastolic pressure would be the decrease of pressure during diastole. Due to the elastic recoil again, that is going to push the blood away from the arteries. So you see here how the pressure goes down in the aorta. Now, what happens as we age? Okay, as we age, we are going to lose some of that compliance. Okay, we tend to develop atherosclerosis, so the blood vessels are going to lose their compliance, and that leads to an increase in systolic blood pressure. We are also going to start losing the elastic recoil due to the loss of that elastic tissue. That is going to decrease the diastolic blood pressure. So you see here when we plot age against blood pressure, we see that as we age, our systolic pressure goes up, again, due to loss of compliance developed due to atherosclerosis, and our diastolic pressure tends to go down due to loss of that elastic recoil. Now, this increases the difference between systolic and diastolic pressure, which is the definition of our pulse pressure, which takes us to pulse pressure. So pulse pressure, again, is the difference between your systolic and diastolic pressures. We can feel that as a pulse when you put your hand to get the pulse, whether it's on the wrist, for the radial artery, or on the neck to feel the carotids. What you're feeling, that pulsation or throb, you are feeling the pulse pressure. There are several factors that determine the magnitude of pulse pressure. For example, the stroke volume. So the harder the contraction and the bigger the stroke volume, that means we will get a bigger pulse pressure. The speed of the ejection of the stroke volume, which really depends on the force of the contraction of the ventricles. Again, that would help in increasing your pulse pressure. And then you have the arterial compliance. So remember we said that arterial compliance, as we lose the arterial compliance due to atherosclerosis in aging, that is going to increase our systolic pressure. Now, how do we measure blood pressure? Well, we use a sphygmomanometer, which is made out of that cuff and this pump. And we also have to use a stethoscope to hear the different sounds that are going to develop in the brachial artery due to changes that we are going to provide. These sounds are known as Korsakoff sounds. You can watch this YouTube video. It'll explain it. It has, what the sounds sound like and so on. The basic nature of what you're doing in order to hear the blood, or in order to measure blood pressure, is that you want to pump the pressure inside of that cuff to become higher than the systolic blood pressure. So what you're basically doing is that you are shutting down, you are closing the artery, preventing any blood flow. So you're not going to hear anything. Remember that if there is turbulence, that's when we actually start to hear sounds. At that point, you're going to start decreasing the pressure in the cuff. You'll hear that first sound. That first sound is a very soft tapping and intermittent. That means that you have now opened the blood vessel, and now there is some blood flowing through it, leading to a little bit of turbulence, and that's again translated into sounds that we can hear. That would be a tad above that number would be the systolic blood pressure. Then you're going to keep on releasing or decreasing the pressure in the cuff until you reach the very end where you hear a very low muffled sound. That is where you've hit the diastolic pressure. If you release it even more, now the blood vessel is totally open, so there's no turbulence, and you'll stop hearing sounds. So again, Korsakoff sounds, these are the sounds that respond or correspond and help us measure blood pressure. So this ends this portion, and I will see you in the next tutorial.